Professor Shrivastava, you're holding a symposium on the concept of self-worth, positive psychiatry-based intervention. Can you tell us a little bit about that?
Yes, the positive psychiatry is a concept which deals with interventions to change human behavior from illness to wellness. We want people to see their life as a healthy one. We are looking at the person who is suffering, not at the brain which is suffering. So far we had the concept psychiatry as a brain disorder, but there is more to it, and we are developing and promoting the concept of positive psychiatry, which is a science to incorporate change in the human behavior to deal with the illness, like lifestyle treatment, treatment for quality of life, spirituality, optimism, contentment. So we want that outcome of mental disorder should be measured in terms of self-contentment, resilience, and optimism, that is positive psychiatry components, rather than measuring them as a component of disease. And we feel that this is the next step from recovery, and it will allow people to reduce their stigma, come forward for treatment, take full treatment, and get rehabilitated in the society. So that's one section which is approved by WPA 2 years back, and we are a group of about 60 people with 10 members in the executive committee and Professor Dilip Deshte is heading the group. And so we hope this is a new science, and we have a lot of hope to globalize this process and science. Yeah.
What are the roots of this new science? How did you come together?
We see a number of patients who take full treatment, and we feel that they have improved. We categorize them as improved, but when we really see that, we find they are much more different than what they should be. For example, their ability to go to school, their ability to foresight and plan, their ability to feel worthy for life, their ability to feel in a good and positive self-esteem, and control their physical illness. So when we look at this science, we feel it has not been investigated, because if we recall the ancient medicine, which had yoga and meditation and other self-help modalities or meditation, we feel that these treatments have potential to change human behavior and prevent a lot of mental disorders. So that's the hypothesis that we...
So when you talk about lifestyle treatments, does this involve, for example, yoga designed for patients with mental
yes,
health problems?
A lot of research has been done on yoga, meditation, dietary regimes, exercise, but they are not yet really routinely practiced, and we understand very little from neurobiological perspective. So that is another research agenda for our section, to investigate what happens in the brain when we say that so and so has developed more optimism, is going on his work and has married and have children, than people, those who are really falling out of mainstream of life.
So the goal of your research in the end would be to implement things like lifestyle treatments into the doctors' programs?
That's right. It's not only for psychiatrists, it's for across, we call it a health sciences behavior. So it's very important for cardiologists, urologists, for infertility, for depression, for infective disorders maybe, and maybe for cancer for sure, where positive psychiatry interventions play a huge role, because a number of physical disorders have a very high rate of mental morbidity. And it's much more applicable to, even if we cannot treat a physical disorder like cancer, but it is important to provide them a relief for end of life and decrease their pain and distress, to go through the process of treatment even. So that's the goal, that we can take health across the spectrum of diseases and know the methodology, how do we change illness to wellness.
And what's the outlook for the positive psychiatry based intervention, let's say in the coming decade?
I think in coming decade we'll have totally transformed psychiatry. we will be able to, we hope to be able to demonstrate that a lot of psychological treatments are virtually a biological treatment. They create as much biological changes in the brain as any other medication. And that gives a positive message to people that treatment of psychiatry or psychiatric intervention are not so medicalized, and they are not just pill. There is something more to it. When you interact with the therapist, there is something going on, and what is going on is an alliance which is virtually a treatment. And we expect that these initiatives will produce better, we will make our patients a much better human being, reduce stigma, and bring more and more people into the fold of treatment. That's the goal. And not only psychiatric disorders, but as I said, across the disorders of physical illnesses, it's going to be potentially very, very revolutionized concept.
And one last question: how does it? What's the lookout for financial supports from governments for those kind of?
Yeah, I mean, a little bit has started in the United States, but the new policy has limited resources for conducting research. What we need all the governments to put aside some of the dollars and euros for dedicated research as to how to change behavior and what gives positive reinforcement for the patients to stay. We know that a pill works, but we do not know how to retain that patient with the pill in the treatment. There are a lot of variables that somebody might stop the treatment, somebody might not stop that. The compliance itself is a question of attitude and need for medication. So a lot of these areas which need strategic research, we hope that governments will listen to the neuroscientists, behavioral scientists, and really do the justice for providing them funds for more research.
Professor Shrivastava, thank you very much.